So we have to make those investments. Rather than spending billions of dollars taxpayer dollars on long prison sentences for nonviolent drug offenders. We could save money and get better outcomes by getting treatment to those who need it. And we could use some of the savings to make sure that law enforcement has the resources. To go after the hardened criminals who are bringing hard drugs like heroin into our country. So with no other disease do we expect people to wait until they're a danger to themselves or others to self-diagnose and seek treatment. Every other disease, you got a broken leg, you got diabetes. You got some sort of sickness, we understand that, we got to get you help. And we also understand when it comes to other diseases that if we don't give you help, and let you suffer by yourself, then other people could get sick. Well, this is an illness. And we got to treat it, as such. We have to change our mindset. And this is one of the reasons that the DEA declared a National Prescription Drug Take-Back Day, a day when Americans can safely and conveniently dispose of expired and unwanted prescription drugs in their communities. Because most young people who begin misusing prescription drugs don't buy them in some dark alley, they get them from mom or dad's medicine cabinet. And today, we're also announcing some new actions. First, we're ensuring that federal agencies train federal health care providers who prescribe opioids. This is a common sense idea that you're already implementing here in West Virginia. Congress should follow that lead and make this a national priority. And we look forward to working with governors and the medical community as well. Second, and we were talking, Joe and I were talking on the flight over here, there is evidence. That shows that medication-assisted treatment, if done properly, in combination with behavioral therapy and other support and counseling and 12-step programs and things like that, can work. It can be an effective strategy to support recovery. But it can't just be replacing one drug with another. It's got to be part of a package. So we're going to identify any barriers that still exist that are keeping us from creating more of these treatment facilities. And incorporating them into our federal programs. Private sector partners are helping out to help fight this epidemic, as well. And I want to give them some credit. More than 40 medical groups. From the American Medical Association to the American Dental Association are committing to concrete actions. And we need to, obviously, work with the medical community because they're the front lines on prescribing. This stuff, and so there's got to be a sense of responsibility and ownership and accountability there. We've got to expand prescriber training. Increasing the use of naloxone. I wanted to make sure I was pronouncing that right. So I talked to the expert naloxone. This is something that if first responders have, it can often save quickly the lives of somebody who is having an overdose. So we want to make sure that first responders have a supply of this. We want to make sure that we're getting more physicians certified to provide medication-assisted treatment. We then have broadcasters like CBS that are providing airtime for education and awareness. And groups like the NBA have committed to running public service announcements about drug abuse. So that's just an example of some of the private sector partnerships that we're forging here. The point is, and I'm going to end with this, we've all got a role to play. Because young people like Jordan, they remind us these are our kids. It's not somebody else's kids, it's our kids. It's not somebody else's neighborhood, it's our neighborhood. And they deserve every chance. We've got to make sure that we're doing right by them, we're taking this seriously. And the goal today is to shine a spotlight on this. And then make sure that we walk away out of here, all of us committed to doing something about it. Whether we are a faith leader, whether we are an elected official, whether we're in law enforcement. Whether we're a private citizen, a business, we've all got a role to play. You understand that here in West Virginia, and we want to make sure the whole country understands how urgent this problem is. So with that, I'm going to turn it over to our moderator, Michael Botticelli. Director Botticelli, well, good afternoon, everybody. Thank you for being here today. I, too, want to thank Jordan for his really stirring comments. I think it really exemplifies for us the challenges that we have. but also the success and hope that comes with recovery. It's really astounding. We're here in West Virginia today to highlight the issue, not just because of the impact that it's had on West Virginia, but the impact that it's had across the country. But also, West Virginia is working together to implement strategies to really deal with this addiction. And we're proud to be here to help support that. The president always gives me a lot of credit for talking openly and honestly about my recovery. But, candidly, I'm one of millions of Americans who are in recovery today, and my story is not unique. Maybe this part is a little bit unique, sir. So, thank you, sir. So with that today, we have a great panel of people who are really going to help provide us with information and their insights about what more we can do on the federal level. I'm really proud to be a colleague of Secretary Sylvia Burwell. And, Secretary, I'm going to start. You can feel free to say anything you would like, however. I know we're here in your home state of West Virginia. I know we have talked. You have been personally impacted by this. But you've also made this a key priority for all of your HHS agencies. So may you could talk a little bit about your experience and what HHS is doing to deal with this issue. Secretary Burwell, absolutely. And first, I'll just say I love coming home. It's great to be home. And it's great to welcome the President to the great state of West Virginia. And when I became secretary, this was a priority because it is something that I have personally experienced. Everybody, I'm sure, in this room knows people personally, friends that lost to the addiction. And what happens in terms of their children, in terms of their family, in terms of the community. And what your experience is, personally, I think that is what energizes you to act. And at the department, what we focused on over the last year. Figuring out an evidence-based strategy because we want to get results. We want to change the kinds of things that people have experienced personally, and three things. Number one is changing prescribing practices. When the president said the 259 million, that can't be right. And so how do we work on that? Second is working on medication-assisted treatment. Getting people the access we've talked about today being so important to people. And third is that access to naloxone. And I look at our colleagues in law enforcement because they're usually the front line. And making sure that when something does go wrong, in terms of that overdose, that we can prevent those deaths that are so dramatically impacting the state. So those are the three things. I'm going to stop because we're here to listen today. Thank you, Michael. Director Botticelli, Carrie Dixon. You're a mom of a son who is struggling with in treatment now, unfortunately in prison. But you've turned your struggles into advocacy and action, and you provide support for many. Many parents here and around the country for loved ones who are dealing with this. So what has your experience been? What advice? Do you give parents? What advice do you give us as federal folks about how we can support parents in this battle? MS. Dixon, well, I think initially I want to thank President Obama for coming here today to support. This cause for our community that has substance abuse, it's become an epidemic in our community. And I thank you for coming today, first and foremost. And I want to share just briefly, I've been charged with being a representative. For families around our area and actually around the nation who struggle with this. So if I could just share some comments that we families have in common. President Obama, you take your time. We want to hear from you. MS. Dixon, thank you. I spoke this morning to a good friend of mine who was just calling me to wish me well today and to encourage me in this endeavor. And this friend of mine lost her daughter 2.5 years ago to drugs. And so I don't take this charge of being here lightly. I realize that I'm here to represent families, and I am grateful for that opportunity. I do want to say that as I'm speaking to you, I'm sharing my story. But I'm sharing the stories of so many other family members that are in this community and in the nation that have this issue. And also it's important to know, for the sake of time, I've really tried to make this concise. But this is the tip of the iceberg of what families experience. And endure when they love someone and care so much about someone with an addiction.